Um, we'll start with approving the minutes from our last meeting, which are posted on the website.
Okay, I would submit that we approve the meeting minutes.
Thank you. Do I have a second, Carrie? Awesome. Thank you. Um, so we've put together a PowerPoint that could be used on Wednesday. As you know, on Wednesday we're meeting in a hybrid fashion. So we are at the LOB, but we'll have a Zoom option for people. How many legislators are we expecting at this point, Tara?
I don't know for sure. I heard back from Rep. Dathan and she confirmed. And I heard back from a few others that said that they couldn't attend this one, but were interested in having conversations in the future. So if we don't, I say we still can do our presentation. And then I can send out the meeting recording and minutes to those legislators that we invited. You never know because it's at the LOB, so you never know if somebody's going to just pop in or not.
Thank you. So Tara, why don't we just jump right into it? If you can display the PowerPoint, and then Patrick and Carrie, if we can get your feedback on what's been designed, that would be great.
And everything is, let me see. Give me just a second.
Mhm.
Now, also want to remind everyone, this is in our share drive, so everyone should have access. I had sent that out. All right, let me see. Are you seeing the full screen or are you seeing?
Just the PowerPoint with it, like it's not in a slideshow version, but
Okay,
I could see the slides.
okay, let me put that in slideshow. Okay, how's that?
Perfect.
Okay.
Great.
Okay, I can make these look nice too after we agree on content. But I just kept it blank first.
Not a problem. So we're beginning with an understanding of the council, just to make
Mhm.
sure, I mean, we can't assume everyone knows, and that we have a specific legislative committee and our assigned uh, objectives for that committee. Any feedback on this as an entry point?
Or additions, if there's anything.
Do we have, this is Toby, sorry. Do we have people that are we submitting testimony is my question, I guess, as a,
Yeah, I can talk about that after we review this, Toby.
oh,
We do
okay.
have
All right,
some items that we are looking to submit testimony on.
thanks.
Yep,
Yeah, I think it reads okay.
great. We'll go to the next slide then.
So
So go
are
ahead.
just,
Good.
yeah, these
Yeah.
are just things that I grabbed from conversations that we've had specific to this, working group. So happy to edit, change, or do whatever.
And to respond to Toby's question, we do have working drafts for requesting that ABA treatment. As you know, there was a law enacted during the special session that did move the age from 21 to 26. So it still caps it at 26. And unfortunately, it only spoke to private insurance. It did not speak to Medicaid. So we're hoping to submit testimony to request that they relook at that, include Medicaid, and continuing our ongoing cry that ABA treatment should be for life, not with an age limit.
Okay, thanks.
Yeah. The other areas that we're working on drafts for, there is a bill. Tara's going to be much more knowledgeable about that bill than I am. hoping to increase the amount of funding. So as part of that, we're asking that the funding be thoughtful about the fact that really some of what needs to be raised is not just to close the gap in the wait list, but to increase provider rates so that we can address some of the shortages that are occurring in the field. Did I capture all that, Tara, correctly? Is there anything I forgot on that?
No, that was the information based on what we got from DSS last time.
Is that the bill around workforce and workforce protections or something? I'm sorry, I'm inundated with information today, but like there was a particular bill on workforce. Is that where it will be presented, or will it be presented in what format will it be presented, and which bill will it speak to?
So I have all the specific bills on the next slide.
Okay, great.
About being intentional about what has been discussed about supporting. These were just the overall priorities that we had identified and have been discussing within the group. So
Great.
if I've missed anything or we can get into talking about supporting specific things or, opposing specific things, but this slide was meant to just give the overall priorities for ASDAC.
It's helpful. Thank you. I'm sorry if I don't mean to go down a rabbit hole. I'm just trying to follow this a very quick cadence here these days. So thanks.
Yes, so
Can
the normal
I
storm. Yes, Carrie.
can I ask a question about, well, I guess I'll just ask the question. Can you tell me how much time you have for this presentation and what the objectives are?
So that's a moving target. Right now we have two committee presentations.
Okay.
So this is for our full council meeting. So we have 2 hours blocked for
Okay.
that. We do have some additional business we want to get to. And I was going to provide if legislators are in attendance, I was going to provide them an opportunity to introduce themselves and give them an opportunity to discuss anything that they're introducing or supporting that may overlap with the committee. So if it really is kind of dependent on how much time we have for that. But like I said, I've only so far have one confirmed legislator attending. So I was thinking if each work group could kind of keep it around like 15 minutes for presentation, and then we would have some additional time for questions and follow-up conversation.
So this PowerPoint, let me just sort of drill down a little bit. This PowerPoint is to be presented to the rest of the larger committee, or is it for the benefit of the legislators who may be present or, watch the meeting following?
Right. It's both. Like we're
Yeah.
presenting to the committee.
Okay.
That's because it's our committee meeting,
Yeah.
but we invited legislators to be in attendance.
I ask that because I think we all understand the backstory behind these 3 bullets, but I don't presume that other folks who are not a part of this committee do. So I think in telling the story, and making this somewhat compelling, hopefully, we start with the fact that, and I think we can say this pretty succinctly. Don't charge me with speaking, because I will not be concise with my words, but I think, highlighting for folks the proliferation of the diagnosis, the number of folks aging within this population, the fact that there is sort of a dearth of providers as it stands, just generally speaking, not to mention those who have specific training and expertise related to this population, And compounding that complexity is that those who are working with this population outside of um, those who are approved on the waiver, I guess is what I'm trying to say, are receiving far more on for an hourly rate. So I almost would sort of start at the increased professionals within the workforce, but proceed that point with that which I said before, there's this growing population and a real, I also think like visuals in terms of figures are helpful in terms of processing, because sometimes just reading words on a slide is, so if we could find some statistics related to the number of folks, and certainly we could tell them the number of people on the waiver or on the wait list. That's pretty compelling. And how many providers there are who are approved and what the rates are as compared with standard rates in the field, more generally speaking. I think that's a really compelling argument to make.
Very,
Yep.
very good feedback. Yeah, I think you make really good points around that, and we could actually put this out as like an overview and then get into each of the three really quickly. I'm thinking, Tara, to make the points that Carrie's making. I also skipped over the middle bullet and I apologize. I just realized one of the things that is also, and correct me if I'm wrong, Tara, there's already a bill on the table for this as well about being able to increase capacity professionals to be able to, specifically mental health professionals, to really be experts in autism spectrum disorder. So we have a draft testimony for that as well.
There's actually, you could look at it as there's kind of two. There's one bill that's talking specific to creating a workforce council, and ASDAC is listed as a member on that. And then I have that on the next slide. And then there's another one that is looking to do a feasibility of a feasibility study. This is one of the Transforming Children's Behavioral Health policy recommendations, that they're looking at the feasibility of doing an inpatient treatment, additional inpatient treatment for individuals with IDD and co-occurring mental health, and that could also be inclusive of autism. As we know, hospital for special care, really is only specific for, you have to have an autism diagnosis, so it excludes some of those kids with ID in that inpatient treatment. Community settings like PRTFs often use autism and ID as exclusionary criteria for treatment, and just in general, the mental health field, it's we need to look at some, and we've discussed all of this at length, but I just wanted to say that is one, to look at that feasibility of doing one specific inpatient unit for that, and then the other one is the workforce.
Any other feedback?
So we can beef this up, Kim. We can work together to get some data, and if you
That would
guys
be great.
have data to send, I can work on getting the rates from DSS or DSS, and I can get the updates on the numbers that they'll be presenting, because they will do their presentation on the current waitlist numbers and all of that as well. So, that information will also be shared, but it's good to reiterate it in this point as well. I agree.
Thank you. Let's do the next slide. So we've spoken about a few of these already, Tara, but do you mind, just because I don't have them as memorized, helping the group know what bills we're
Sure.
paying attention to?
So Senate Bill 18 was the one that is came out of committee and is referred to appropriations, but appropriations has not set a public hearing on that or have it on an agenda to my knowledge. So it's kind of just sitting there right now. Appropriations is the last committee that can have meetings and submit joint favorable reports. So because of the money piece. So those deadlines for the other committees are coming up, a lot of them by the end of like this week or next, and then appropriation. So it's not being, to my knowledge, it's not being heard yet, but it's out there. So it's Senate Bill 18 is to increase funding for the autism waiver. 5447 is the one that is the TCB recommendations that they voted on to do a feasibility within current appropriations of funding, an inpatient or PRTF. We don't know that PRTF rules and regulations will allow and maybe be the best treatment modality, but looking at some kind of inpatient setting for young adults who have the co-occurring behavioral health and ASD or ID diagnoses, as we discussed. 383 is the career pipeline one where ASDAC is named as a member of that work group. And then 5485 is a just supportive decision-making bill that is looking to increase awareness and education on supportive decision-making in lieu of guardianship.
Any feedback on this slide?
And again, this would be more to discuss and ask. I mean, we did write letters for Senate Bill 18 and 5447. And then we wrote another one, Kim, that you wrote right in just asking for the increase in ABA in general. So that's not connected to a specific bill, which is why we would need to maybe talk more specifically about that in the previous slides.
That makes sense.
So it'd be helpful if you guys take a look at these and kind of can speak to, or, your support or opposition, or, what additional language you may offer, or, where are they missing the mark? That kind of stuff. So, but these are the ones I kind of have tagged so far.
We at DRCT, we are, we are part of the STM coalition, so we are supporting that work.
Okay.
And then, yeah, I have to look into these other there's so many bills that we're inspecting and dealing with. These other three. There's also one I think that's being heard tomorrow on long-term supports. Is that one of these or no?
No, I don't have that in there specifically.
Okay.
Yeah. For this group, I kind of focus on autism specifically. Obviously, long-term supports is autism too, but are you talking about more of the FI stuff and like?
No, I mean, tomorrow, the SDM stuff.
Okay.
It was really, I can look it up. Let me find it. Hold on one second. There's so much stuff going on. Okay, so I think, well, there's SB 430. Have you talked about that at all, about the act of codifying the Americans with Disabilities Act? That's one that we're really focused on. And then also SB 433, an act expanding long-term care options.
Okay.
both of those. We're, and again, I'm here to support the autism focus of this committee, but as an organization, we represent a lot broader interests.
Right. There's also, I forgot another one, and Kim, we hadn't really had a chance to discuss this one yet, but there's also Senate Bill 401 that mentions autism that would be another one you guys could take a look at.
Are you able to tell us a little bit about 401?
So this one is sorry, I'm just checking to make sure nobody else joined. This one is to provide, and they specifically call out people with an autism spectrum diagnosis. They're proposing a state, this is Senator Austin. She's proposing a state bridge program to help fund SNAP benefits and other
Okay.
things that address food insecurity for those who may not have met the work requirements. Now, proposed in the federal Big Beautiful Bill Act. So if to kind of for the state to capture those individuals and provide some kind of bridge till they can get back on those federal SNAP benefits.
Thank you. Yeah, that would be important, I think, to connect. Other thoughts, feedback? Something that we should have mentioned and didn't.
I'm just curious, Tara, it's been a while since I've been on the shared drive. Will will this legislation be posted so we can quickly find it?
I put links in the to the ones that we've discussed. I will add links to the other ones mentioned.
Great.
So that you guys can easily access that. When you click on the link, I'll just show you real quick. Is it I'm a visual person, so let me just share real quick. I have like 500 windows open. Okay, so you see where it says proposed Senate bill.
Yep.
Okay. So when you are on these this is what I'm linking to. So you can see right here where it says text of bill. If you click that link, it'll take you to the full bill as it's in. If they have proposed any additional language, it would be linked there as well. This is where you can go to submit public hearing or testimony, but as you can see, there is no date or anything submitted at this time. So that's kind of where you'll see that information. So if I click, I don't know if it'll open for me, but
Yep.
there. So if we click on Senate Bill 18, it's very short because it's just a proposal, but they're proposing $5 million be appropriated to the Department of Social Services from the general fund for the next fiscal year to support the autism spectrum waiver program. So they're not calling out specifically what the funding is for, except down here to say alleviate the lengthy wait list.
Right.
Thank you, Tara. All right. We don't have any new proposals, I assume, Tara, from
No.
Okay, thank you. I'll just keep reminding people we do have a link on our website that allows anyone in the community and any of our members submit proposals for us for consideration for legislative priorities. On that note, we're done. So I can give a half hour back to your life.
I
Tara?
just want to mention real quick too, and I don't know how much you guys want to get into the weeds or, but there are some additional bills that are being discussed that we could expand, like to Toby's point, long-term supports and services. There's also some nonprofit insurance information. There's some funding for special education and some other. So if you would like more of that, like please let me know. I'm happy to include all of the additional things that we're kind of watching. And then also I would say there's the share drive, and there was one more thing I wanted to remind you guys about. And I'm totally blanking. If I think of it, I'll send it.
Okay. So if you have
Oh,
any,
I remember.
go ahead.
Sorry.
Go ahead.
Today was supposed to be, we were working on getting the Social Security Administration to come do a presentation on those disability determinations specific for autism. As we had discussed, we're hearing that some people aren't getting those determinations specifically based on an autism diagnosis and or losing their benefits at some point as to not meeting the requirements. So we did invite them. I have not heard back from them yet. So working on trying to get that training set up for one of our next meetings.
Toby?
Yeah, on that note, I'm so glad you brought that up, Tara. We do have the protection and advocacy for Social Security beneficiaries. So we have staff that can present to this group and share information. So please let us know. I told my staff after the last meeting that we should probably present to this group, but like I need to know dates and times so they can adequately prepare. And then the other thing, I think yeah, just like signing on to the idea of like passing on more information, Tara, related to the other bills that intersect with our interests.
Thank you, Toby. That's a great offer. And Tara and I will talk about organizing those things.
Great.
So if you think of anything after today's meeting, we're putting the final touches on this because it is for Wednesday. But feel free to email Tara or myself with your feedback, and or if there's anything else we should be calling attention to in that PowerPoint, it would be greatly appreciated.
And check the share drive because it'll all be updated in there. And it's next Wednesday, the
I was
8th.
just going to ask that. Thank you.
The 18th.
I'm ahead of myself. I want spring so
I
badly
didn't wanna-
that I'm
I
just
didn't
like,
want
hurry up, hurry up.
anybody
Yeah.
out that we're doing it this week. Yeah. We have
That
a
was
little bit more time.
Yeah,
Thank you.
that was my other question because I have this like when I go into Teams, it gives me this like state invitation. Is that what it is?
Yeah.
Okay, I'll try it.
And unfortunately, I won't be much help in trying to get you in beyond the fact that I have added everybody. So, because I can't necessarily see what you see, but happy to jump on a call if we need to work through it together.
Yeah, it's blocking me from seeing things I want to see. So I'm moving around it, but I'm glad that I'm invited. Thank you.
Yep. I can always resend an invite too, if that
Great. Perfect.
helps.
Thank
Okay.
you.
Yep.
All right. Unless there's anything else, thank you, everyone, and enjoy this lovely weather.
All right, thanks.
Thank you.
Bye-bye.